COVID-19, Supporting Autistic Adults, a Guide for Professionals, prepared by Leeds Autism AIM. Introduction. This is a quick summary of ideas for supporting autistic adults through the COVID-19 pandemic. It has been prepared by Leeds Autism AIM, a free service providing advocacy, information and mentoring, peer support and signposting for autistic adults in the Leeds area. It is co-led and staffed by autistic adults. We have also produced a COVID-19 toolkit of resources for autistic adults. It is available to view, download and print from our website www.leedsautismaim.org.uk. Why have we published this guidance? This is a stressful and uncertain time for all of us, and in some ways it is true to say that we are all in the same boat. However, many people with disabilities, including autistic people, are experiencing a loss of support and resources as a result of the COVID-19 pandemic. Some of the consequences of the pandemic, disruption of routine, uncertainty and unpredictability, unfamiliar communication requirements, are especially challenging for many autistic people. In this guide, we cover some of the key topics that will help you to support autistic adults through these challenges, including communication, mental health, links for further support, and self-advocacy and advocacy resources. Communication. How can we make this easier for autistic people at this stressful time? Plan in advance how you will communicate. State the options you can offer, Skype, Zoom, WhatsApp, etc., and ask the autistic person's preference. Aim for neutral background in video chat and minimum background noise. Turn devices to silent, turn off notifications, etc. Offer a summary after any conversation, topics covered, next steps, action points, etc. Allow plenty of processing time, maybe up to 3 times the time you would usually give. Set an agenda and stick to it. Keep referring to it throughout. More suggestions in our guidance document via leedsautismaim.org.uk. Supportive advocacy. What might we do differently during COVID-19? When we are under stress, our ability to communicate can be challenged. Autistic people may be finding it harder to communicate their wishes, preferences, and needs. Your usual approach to empowering a person to self-advocate and take action themselves may not be as effective as it usually is. A more supportive approach, where a person may need you to advocate for them, may be crucial to somebody's welfare. Gain the person's consent to make phone calls, send emails, and make inquiries if they express a wish for you to do so. Addressing social isolation. Social isolation is a common issue, and social outlets may have been cancelled or restricted. You may need to support people to find online social outlets. These could be being part of an online gaming community, taking part in classes on Zoom, etc., joining online forums, finding autistic online communities. Our toolkit contains information on some of these online social activities. As ever, it is important to stay safe online. Routine and planning. You may find resources in our toolkit useful in supporting autistic adults to establish a routine. Resources include daily, weekly and monthly planners, a weekly meal planner, a poster for display in a window or door asking delivery drivers to leave what they're delivering at the person's doorstep, a communication alert card for general use, a mental health passport for general use, a self-care planner, health resources from organisations such as the Leeds Teaching Hospitals NHS Trust. Your support will be an important part of somebody's new routine, so sticking to regular times and days may be more important than ever. Resources available here. Planning ahead. Many people may have had long-term goals or plans that are now on hold. It is important to reassure them that when restrictions are lifted, these can still go ahead. For some, the current crisis may be enough to deal with, and helping them with the immediate issues will be the most helpful thing to do. Others may wish to use this time to plan ahead and may value your support with this. Information overload. Clients will likely be overloaded by too much information and may need extra help finding the right information to process when they have the capacity to do so. Leeds Autism AIM have produced a blog post they may find useful, which can be found in our toolkit. Leeds Autism AIM have reallocated staff time to making sure that we have up-to-date information on a range of subject areas. Check our website for a list of coronavirus-related resources. If you are unable to find any information, please contact us at leedsautismaim@advanet.org.uk. Signposting. We have collected links including for the following: mental health issues, developing new issues, and the resurfacing of existing ones. If a person is in immediate danger of suicide, call 999 to arrange a welfare check with the police. Conditions that may co-occur with autism, for example, eating disorders, obsessive-compulsive disorder. Substance misuse, experiencing domestic abuse. Autistic adults may struggle to identify when they are involved in an abusive relationship and may benefit from specialist support with this. Please note that as a Leeds-based service, we are unable to provide details of services outside of the Leeds area. Where to find these and other resources? To access these and many other resources in the Leeds Autism AIM COVID-19 Toolkit, follow the link here or type this address into your browser. You can email us with any questions or ideas to add to the toolkit at leedsautismaim@advanet.org.uk and follow us on Twitter at Leeds Autism AIM or find us on Facebook. Thank you.